We are so pleased to welcome Dr. Karen Zurlo. Dr. Zurlo is an associate professor in the School of Social Work at Rutgers University. She is well-versed in retirement-related topics, and her research interests include gerontology, retirement, financial well-being, health, life course development, social welfare policy, and international social work. Thank you, Dr. Zurlo, for being with us today, and welcome.
Okay. Good evening, and thank you, Alex, for that warm introduction. As Alex mentioned, my name is Karen Zurlo. I'm an associate professor at Rutgers University in the School of Social Work, and I am very pleased to participate in this panel's discussion to present to you on this topic, which I believe is a very critical one: minimizing the risks of women aging into poverty. Initially, I will illustrate some demographic shifts in the older adult population. Then I will discuss what the risks are of aging into poverty. And from there, we can review a few interventions that are based on strategies for individuals, as well as strategies related to policy and advocating for legislation that better supports the financial needs of women. So this is my first slide, which depicts a demographic shift. And as you can see, it shows the population age 65 and over, and how that number of individuals in that age bracket have grown in number over the years. From 1900 to 2020, you can see those 65 years of age and over have grown dramatically. But it's important to note here, it also shows that those 85 and over have grown in number. For the first, I'd say 70, 80 years, 1900 to 1980, there was very little growth in that age group, 85 and over. But you can see once we hit 2010, 2020, that number is growing fairly dramatically. And that creates some new pressures and understandings of the needs of our more senior older adults in the United States, as well as those age 65 and over. The second slide, as an indicator, shows the ethnic and racial composition of older adults. And you can see for each racial group, there are two bars. The dark blue bar shows that percent of the population in 2014, and the striped bar shows the projected population of that ethnic group in 2060. So what you can see here, one of the key takeaways is the percent of the population who is non-Hispanic white will decrease over those 76 years, from 78% to 55%. But as you can also note, the non-Hispanic Black population will grow, the Asian alone population will grow, as well as the Hispanic and Latino population. And it is that group that will show the largest increase in the total percent of older adults age 65 and over. So this again is an important shift because it will change how we age and what services are needed, and who in the more generic population will be available to serve this more diverse and ethnically racial group. And finally, this is the third indicator I included in the presentation. It shows mortality, known as death rates among people age 65 and over, and what have been those leading causes of death since 1981. Well, you can see the top line shows the decrease in number of people who have died from heart disease. So as you know, we've had some very important developments in science that have improved the rate of people who are living with heart disease and who are no longer dying from this chronic condition. People are more aware of what to eat and how to exercise, so the numbers of those who've deceased from this disease have decreased. But whereas though you can see cancer, stroke, diabetes, influenza, Alzheimer's, and chronic lower respiratory diseases have not decreased as much in number of deaths. As you can see, it's because the research hasn't caught up with what the needs are. And we still face many challenges as older adults in combating these diseases. But because the mortality rates have decreased, it has led us to have then a greater number of older adults aging into their 70s, 80s, and 90s, and in general, having a greater longevity. What I also thought was important to include here, since this topic is highly related to poverty, is, who is poor in this country? What are the percentages for those age 65 and over? As you can see, this is a picture of the United States and the poverty rate for people ages 65 and over. The states that have a white coloring have a very low percent of poverty for their older adults. And the darkest purple show those states with the largest or highest rate of poverty. That includes Mississippi, Louisiana. But if we want to focus on New Jersey, the average poverty rate for adults, again, age 65 and over, is between 10 and 10.9%. And that's the average for the entire state. But when we get to this slide, I thought this was important because it shows the poverty rate, again, throughout the United States, but for older adults in metropolitan areas. So that depicts those in urban areas and what the poverty rate is. And I feel that's very important for those of us focused on poverty among the older adults in New Jersey, because in this particular slide, you can see for New Jersey, urban areas, the poverty rate is 12 to 15.9%, which is significantly higher than what we saw in the earlier slide, where the range was 10 to 10.9%. So you can see among older adults, the predominant number who are poor live in urban areas. And that would be Camden, Trenton, and Newark, and send the wider areas around those cities. So when we think of poverty, and it's a topic that's so important to all Americans, we want to have a better understanding, well, what are the risks associated with aging into poverty as a woman? And I've included a short video here of a woman named Veronica, who's 70 years of age, and it's her story of how she's dealing with her financial pressures later in life.
Women are nurturers. They're going to work and they're going to take care of what needs to be taken care of. When they're sick, they're going to get up and they're going to go anyway.
65% of older people needing long-term care rely on family and friends. Women provide the backbone of that support.
We helped take care of our parents as they were growing older and then died. We take care of our children, and now we're taking care of our grandchildren. I've worked since I was 12 or 13 years old. I mean, a job. I wasn't home babysitting. I was actually out working. I'll be 70 and I'm working 2 jobs, 3 jobs. I have a full-time job at the House of Representatives, and it's a catering company. I may go in at 5:30 or 6 o'clock in the morning, and I may work there till 7 or 8 o'clock at night. And that's that could be Monday through Friday. Some weeknights and weekend nights, I work at the Ronald Reagan International Trade Center with the catering company there. So I'm working all the time. I'm standing. It's no sitting. It's physical labor. It is, and it's not necessarily easy. But in order to take care of what I need to take care of, even though I'm not really taking care of it like I'd like to, I'm still doing it. And I help to take care of the grandchildren and any nephew, niece, or cousin who calls and says they've got an issue. If I can, I try to do that.
Women have often spent many years taking care of other people, often unpaid. They've often also had lower wage jobs. So as a result, a lot of women enter their later years with less resources, less money in Social Security, less money saved for retirement, and can end up in poverty.
I'm struggling to keep the bills paid. I've got to call the electric company and say, listen, I can't pay the bill this month, but I can arrange to pay it, 3 weeks from now. And you'd like to think that, maybe you could retire at a certain age. You can't. You have to work. So I think that, it would be nice to give some breaks to people as they get older so that they don't have to worry so much about, being able to afford a place to live.
Older women have spent so much time in their lives caregiving. It's time that we take care of them.
This is a two-pronged fight. The first prong is supporting all the movements that help a woman over her entire lifetime. So educational opportunities for girls, fighting for equal pay and against gender harassment, supporting the Me Too movement, and also racial justice work. The second prong is defending and improving the programs that older women rely on now. These are programs like SSI and Medicaid that older women need to survive, having faced a lifetime of discrimination and harassment and the effects of that.
We've been relying on older women for generations. Now they're relying on us. We need to do our part.
Women.
So as you can see, Veronica faces challenges on a number of fronts. She's 70 years old and she still has trouble paying her bills. She sounds like a very generous woman who's willing to give money out to family members who might need that. And she's also helping raise grandchildren. So it's a huge challenge for a woman who's African-American in her 70s. And because there is a risk of entering poverty in all ages of life, there are two scholars from Washington University in St. Louis. Their names are Mark Rank and Tom Herschel. And they wanted to give more thought to how can we better confront poverty and minimize the risk of who will be entering poverty. So they've designed what I show here as the poverty risk calculator. And it's a tool on the computer. You can use this link to use it yourself, to put in some different data to see what different risks are. But what their basic purpose is to use these 5 risk factors to assess the probability of a person entering poverty. And as you can see, the 5 risk factors are age, one's age, their marital status, are they married or not? What is their gender? What is their race? And what is their level of education? And so I put some data into this calculator and I've just compiled this slide to show you what the variation is in probability based on some different demographics. So what you see here is the standard for what I put in is for a female, high school or less, and currently is aged between 70 and 74 years of age. And the question is what is her probability of entering poverty in the next 10 years? So you can see on the left side of the diagram, is the person white or non-white? Well, if we look at the white female first, if she's married at the age of 70 to 74 and has these characteristics as part of who she is, she will have a probability of entering poverty of about 28%. Though we look at the blue bar of her unmarried counterpart, that woman will have the probability of entering poverty at the level of 50%. So being married or not matters. And for this person, there's a significant difference and an increased probability of aging into poverty if she's not married. Then we look at the woman who's not white. If she's married as a non-white woman, high school or less, 70 to 74 today, her probability of entering poverty is about 50%. And if we look at her unmarried counterpart, the probability is about 87%. So you can see that it's an important tool, I think, for us to really understand, how can we then mitigate some of these risks earlier in women's lives so they don't face this exacerbated probability of poverty in later life. So based on even the video about Veronica and my understanding and work around issues related to poverty and older women, there are 2 ways to really approach this issue if we want to consider interventions and how to minimize and mitigate some of these risks. One is to focus on individual strategies, and the other is to focus on policy strategies, where the poverty strategies would assess national, state, and local issues and policies associated with poverty that can be modified at any of these 3 levels. I'll go into a few details or examples now. So the first one, if we look at individual strategies, is I think fairly basic, and this is at the individual level, how to start saving earlier for retirement, because it makes a difference when then one is ready to retire in their 60s or early 70s. So this is an example of 2 individuals. One started saving at the age of 25, and the other started saving at the age of 35. by starting to save at 25, this individual saved $100 per month with an annual compound interest rate of 5%. So you could see over time, from their age of 25, 40 years later to the age of 65, that individual who started early was able to save $160,000 for their retirement. Now we can compare that individual to the person who started 10 years later at the age of 35. That individual saved the same amount, $100 per month, compound interest rate of 5%. But at 65, you can see they had in savings about $90,000 compared to the one who started 10 years earlier, where the saving was about $160,000. So that's a $70,000 difference that the person who started at a younger age had accumulated over time. And I think this is an important point for us who want to work with young people and educate them about how to start saving for retirement when they're entering the workforce, not waiting till their early, mid, or late 30s, because it does make a difference over time. And that difference is predominantly due to the time benefit they receive from compound interest in this particular example. So when we think about financial well-being and we want to see every individual experiencing that, well, what is it? What it means is to have minimal financial strain and a satisfying level of control over one's finances. And I can return to, again, the video with Veronica, how she had difficulty paying her electric bill and she wasn't able to retire. She had certain financial strains that she had to deal with. Even helping her family members financially. So for her, financial well-being was not part of her existence. She may have had control over her money, but it seemed as if her expenses outweighed her income, and she had to work the 2 jobs and help family members, which created the financial strain that she was experiencing. So one way to understand financial strain is to ask individuals about how would you rate your financial situation? Is it excellent or very good? And you can see from this chart, this is data that was collected by ARP in June of this year. And they asked people of all age groups, well, how would you rate your financial situation? And you can see the older adults from 70 to say 80 plus said 50% or so said their situation was excellent or very good. What that tells us, the other 50% were not having as good a financial situation. They could have said their financial situation was poor or average. But when we look at the younger people, 18 to 39, 40 to 49, even 50 to 59, as we get into mid-age, we can see that there weren't as many people rating their financial situation as excellent or very good. So these are the age groups that are struggling. And I think that's an area of intervention, because we can ask, well, why are they struggling? What do they need that can help them feel more financially secure and feel more satisfied with their financial situation? So a key component to income in old age is Social Security. And as many of you may know, the amount an individual receives from Social Security is dependent on what they earn during their lifetime. Also, how long did they work, and was their work life interrupted at all? For women who tend to not work as late in their lives as men, and who often have interrupted working lives, their Social Security benefit is significantly less than that of a male. And what's important to note here, that for poorer Americans, poorer older adults, that dollar amount from Social Security typically is a very large percent of their total income. Poorer older adults do not have additional sources of income as much as a wealthier mid-income and high-income older adult might. So the older adults who are wealthier have different sources of income. One goes away, that shouldn't affect their economic security very much. But for those who are poorer and rely predominantly on Social Security, that's a very important source of income for them, because it contributes a large portion of their total income. And on this slide, I also included, well, someone might say, well, what's the average monthly retirement benefit? Well, it's $1,631, and that was from October of this year. So if that's what an older adult is predominantly relying on and living in New Jersey, that money most likely will not go very far, especially if they're paying rent or a mortgage. But we want to think about, well, then how can we prevent significantly higher risks of poverty for older adults, for older women, excuse me, compared to men? And that requires, I believe, a specific focus on our pension systems. And again, there are ways to look at pension systems to say, well, what's needed to shore them up? One is credit for caring periods where a woman might be out of the workforce for a particular period of time, caring for either an older relative or a child. Can credits be associated with that period of time when they're out of the workforce? Are there minimum pensions and are there survivor benefits? So these are all avenues to pursue if we want to strengthen and shore up the pension system so older adults can use more than just Social Security in their retirement years. And what's very important in the constitution of understanding financial well-being is asking yourself, well, what control do I have over my financial circumstances? And I think this is just a good measure to ask people in your life who you care about, who may be at risk of less financial security than they'd like. What level of control, from 0 meaning no control to 10 meaning very much control, do you have over your financial situation these days? And if it's not a lot of control, the next question would be, well, how can you gain more control? And what changes can you make in your life so you then have more control over your finances? And what I would hope is then that would lead to a more financially secure future. So what does financial control depend upon? And these are just some basic questions. What is your marital status and partnership? And who manages the money in your household? I don't know about you, but I've seen from my research and my writing, many women don't have control over their monies in their marriage. And if their partner dies or husband dies before they do, they're left with oftentimes what's considered a financial mess. They don't know how to manage the checkbook. They don't know who to pay their mortgage to or their rent to, what's excess funds for food and electrical bills. So there are many challenges associated with not having that control. But to have that control, you need to have some financial knowledge. So what is that knowledge? And where do you need to maybe gain more knowledge so you can be more confident and more assured of making financial decisions? What is your interest and willingness to manage your money? I would hope that even just minimally from this presentation, you may realize, I need to take some control and manage my money more going forward than I have in the past. And do you take time to pay your bills on time, manage your checkbook, investments? These are also very important questions. But what the bottom line here is to help you be more confident, I would feel and believe you need to become more financially literate. And that would mean by increasing your financial knowledge of even the basics and then expanding it into any investments and other parts of your financial portfolio. So financial independence is important because when you have enough savings and income, they can support your current spending habits and expenses typically. So what's important to consider to gain this independence and to gain more control of your finances? Well, pay your bills on time. You don't want any late fees accumulating. Have a rainy day fund. That would be like an emergency fund for an economic shock that could surface in your life. How is inflation affecting your budget? This year we saw inflation pretty significantly in the cost of many everyday items that we use. Gasoline, bread, milk, eggs. Our budgets were taxed more because of the increase in price of basic goods. So that meant less money for either savings or for even adding to some financial strain that you or your family may have experienced. You also want to understand your health insurance programs, especially as you get older, Medicare, Medicaid, supplemental plans. What is covered? What is not covered? What are your premiums, co-pays, and what can you afford as an out-of-pocket expense? Oftentimes when we have a health issue and it's not covered by our insurance programs, for example, you need new eyeglasses or you need a hearing aid. Well, that's not covered by our traditional insurance programs and plans. You would have to pay out of pocket for that. Can you afford it? And if you can't afford it, then how do you manage your day if you can't see well or you can't hear well? So these are questions to consider as you get older and may have the need to spend money that's out of pocket and not covered by your health insurance program. And then another important point here, it's available through Brightside Manor and the staff that's on this phone, this Zoom call with us, but what are the additional resources available? Well, there's the WISER program, there's the SFSW workshops that were alluded to at the start of today's presentation. And if you're working, what about going to your human resource department? How can they help you by providing additional resources? So now I'd like to transition from individuals and more independently oriented strategies to those that are more policy related. And one example I will use is what's called the Secure Choice Program. So this is an example of a chart, and I feel this is fairly important. I'll take a minute or two to explain it. It shows the number of active participants in pension plans in the United States, and it's from 1975 to 2019 in millions. The blue line depicts the number of people participating in what's called a defined contribution plan or a DC plan, and they're typically known as 401k plans. The DB plans, which is the orange line, they're known as defined benefit plans. Those plans that are organized by corporations and the employer manages the employee's pension through the DB plan. The individual has no control over that money. And typically the amount the person receives in their retirement is determined by the number of years of service, their age when they retired, their age when they started working, and what level they were in the corporation or with the employer. And then it's what I would call an annuity. It's an exact monthly amount, the same amount every month until death. And that's a DB plan. But you could see the number of individuals participating in those plans has decreased since about 1980. Whereas the number of participants in defined contribution plans has skyrocketed. And the reason being is it's around that cross section, 1982-83, that legislation was passed that gave less incentive to employers to offer DB plans and a greater incentive to offer defined contribution plans. And the reason being is employers wanted to get out of the business of providing retirement income. They were willing to say, I'll give you a match to what you contribute, but then the management of the plan is on you. So if you're working for a large employer, that employer will typically work with a different investment company, and you're responsible for contributing to the investment in your retirement plan and managing those funds over your work life. With that, there are some strengths and weaknesses with these two programs. Employers felt, like I said, they didn't want to be involved. They wanted the employee to take over. So that's a strength to some degree. But the downside and the difficulty is then the employee needs the knowledge, the wherewithal to manage those monies and to participate. And just so you know, what's happened, I believe it was in 2016, a new legislation was passed. And what that legislation now does for any employee starting with a new employer, their retirement contribution, they are automatically opted into the retirement plan. And a small percent of their money will be contributed monthly. In the past, you had to personally opt in. But because many state governments and the federal government saw not as many people were opting in, the law changed to say now if you don't want to participate, you have to opt out. So it's a new way for employees to say, okay, they're telling me it's important I save for retirement. They're giving me this opportunity. I'm in. How do I best invest this money? Can I contribute more than the minimum? And what is the match from my employer? And how are those monies being invested? So that's the kind of the two-sided coin to this shift. But what really means, or what is relying on, is the individual. The employee then has to manage their funds, and so they can then have a good retirement income when it's time to leave their employer and be retired. So what the Secure Choice program does is, because many small employers can't afford to offer a defined contribution plan, many states said, okay, we're going to combine these small employers and as a group and help them to offer their employees a retirement plan. So in our case, the state of New Jersey authorized the creation of the Secure Choice Savings Plan in 2019. It's a state-sponsored retirement plan designed to help more private sector employees save for the future. And it is independently administered. And this particular board held its first meeting in December of 2021. But an avenue to intervene here, and I share this with you because I feel this is important. If you want to take this action, contact your legislators and advocate for enacting this program in 2023. It's currently not enacted. There are some meetings that need to take place so the organization of this program can be solidified. But right now it's sitting on legislators' desks and no action is being taken. So if you want to try to intervene on a policy level, this is what I would recommend. Another important program, this is called the Supplemental Nutrition Assistance Program, SNAP, formerly known as food stamps. And this is an important program that seniors can benefit from because it enables them to go to the supermarket and use their little card to buy groceries. But the issue around SNAP is this, and I feel, again, this is an important area for intervention. In New Jersey, many seniors miss out on SNAP. So you see on the left side, the top half says the percent of eligible seniors benefiting from SNAP in a month. It's not even 50%. So what this tells us is that there are many eligible seniors who are not benefiting, and that's 52% who are eligible do not benefit. The bottom part of this slide shows the average monthly benefit, and from 2017 is $123 per month. So this is money that's kind of being lost to seniors who are in need of financial support for from SNAP to help buy groceries. And it's an area, again, of intervention for individuals, for groups, for any community organization that wants to say, okay, how can I help seniors who are eligible but not participating become a participant of this program? And I feel it's personally very important and a way to assist and help seniors elevate themselves so their risk of poverty is not as severe as it may currently be. So this could be done. This is just 3 basic ideas. Educate policymakers on the importance of SNAP in addressing senior hunger. Partner with different organizations on the benefits of SNAP and provide application assistance to those who are really not aware of it or need the assistance with the application process. And the third bullet says adopt. Adopt state practices and policies to help ease the barriers to SNAP enrollment so you can ensure the maximum benefit to which seniors are entitled to receive. So if you have new and better practices, it could help ease any barrier to enrollment. And barriers to enrollment exist on a lot of different programs. So this may be one place to start and help seniors just receive this benefit, as small as it might be, $123 a month, so they can have better food choices and have greater financial support. There are some additional programs also that are available to seniors that can help. One is LIHEAP, the other is PAAD, there's the tax freeze, the anchor program, and the Extra Help Program. And all these programs are available, and the staff at Brightside Manor can certainly help you better understand these resources and provide direction to how to take advantage of them and enroll so you can take advantage of them. So the two-pronged approach for minimizing risks, so that's how I kind of began my presentation. One is focusing on individual strategies, how to increase human capital. Well, one way is to obtain more education, skills, and training. And through this training, increased financial knowledge, hopefully seniors can be better prepared for any economic shock. Now, you might say, well, what is an economic shock? Well, it could be a loss of job, it could be bankruptcy, it could be a serious health issue, loss of health insurance. All of these circumstances create financial strain on individuals and especially on older adults. So if you can be better prepared and have that rainy day fund available to you, you would not experience as great a shock as any of these losses would really provide in your lives. The other component here to this two-pronged approach is looking at policy strategies. And again, I've said this can be done at the national, state, and local level. Well, what to do? We talked about SNAP, we talked about the secure choice option. What about advocating to raise the minimum wage so it's a living wage, increasing the earned income tax credit, and stimulating growth in quality jobs? We also want to improve access to public goods such as education, healthcare, affordable housing, and childcare. And when we looked at the slide showing how wealth can be accumulated starting at a very young age, well, education at a young age can really help an individual understand the importance of saving earlier in their lives. That will help mitigate any risk of living in poverty in late age. So it's one example of education, public general education, and then focusing on financial education and management of a household and how to take control of finances. And the last bullet point here I think is important, and I want to just comment on it briefly. Asset building opportunities in low income communities. Many of you, I'm sure you have read, because it's been in the press extensively, that when we think of assets and differences in wealth, there's a huge disparity between the wealth of whites in this country and the wealth of African Americans. And to a large degree, this disparity is due to limited asset building opportunities for African Americans. And one of the reasons why their opportunities are limited is because they have not been able and afforded the opportunity to buy a home in a safe neighborhood with a down payment, a competitive interest rate. So there's much work to be done around promoting asset building opportunities in low income communities. And that can be among young people. Because again, if you have this asset and you pay it off as, let's say, as a mortgage, your home is what you purchased, you pay off your mortgage, that asset can be a sizable form of income for you in late age. And oftentimes, as we see and have read about, African Americans have much less wealth than whites. And if we can help them build assets and accrue assets and gain wealth, they will have less risk of poverty in old age. So just to conclude my presentation, growing older adult population, it has strengths. It provides significant resources. We can see the number of folks are growing in number. We will have a more ethnic and racial composition of older adults. People are living longer, health is being improved. So there are a lot of good, positive directions we're going in. But to live in later life, you need money. And to have money in late life, you need to start saving and accruing early in life. So financial well-being is important, and it's never too late to get control of your financial circumstances. So I feel as if, although we're focusing on minimizing the risks of women as they age, one important way of minimizing this risk is starting at a very young age. Thank you very much for your time.